And the fact that birth and death are the two most major life transitions bring up a lot of the spiritual questions similar to those we might see when we are navigating death.
Yeah. Yeah, I feel like that also takes people off guard quite a lot, right? Like suddenly we're faced with this concept of our mortality in a totally new way, and also the mortality of our children.
Yeah.
And like
Yes,
that is really intense, that's a
it
really
is.
intense
It
thing to be
is.
faced with, especially when you're pregnant. Like, I think that you can have this experience whether you're pregnant or not pregnant, if you're adopting, if you're the non-pregnant
Yeah.
parent, like all of those things are present. But I do feel like when you're pregnant, especially, you and in the early weeks, you really feel like, okay, we are walking this tightrope right now,
Mm-hmm.
and things could go one way or the other
Mm-hmm.
really easily.
Mm-hmm. Mm-hmm.
And that's going to bring up questions about mortality for you.
Mm-hmm.
Um,
Mm-hmm.
and that can feel really destabilizing. And that's a topic that we often, I would say, most of us in like the Western world spend a
Yeah.
lot of time just avoiding.
Absolutely.
Yeah.
Yeah. Uh-huh. So I'm sure it's, stands to reason why it might be even more internalized and avoided maybe during pregnancy.
Yeah.
Yeah.
And yet it's kind of unavoidable during pregnancy. Like something I see so
Mm-hmm.
often, I saw it in myself, I see it so often in clients, I see it in
Mm-hmm.
friends, is this really overwhelming anxiety.
Mm-hmm.
And
Mm-hmm.
I think there's a lot of reasons and causes for that anxiety, but I do feel
Mm-hmm.
like this kind of proximity to death
Mm-hmm.
is part of that,
Mm-hmm.
is a big driver of that. And when this kind of goes back to why talk about matrescence versus just kind of perinatal mental health disorders.
Yeah. Yeah.
If we're just talking about avoiding or solving or resolving the anxiety symptoms, we are not giving people the opportunity to
Mm-hmm.
explore that
Mm-hmm.
huge concept.
Yeah.
And I would be curious for you because you've worked so much with grief and loss
Mm-hmm.
and death and
Mm-hmm.
dying, like just the psycho-spiritual opportunities of kind of getting closer to
Mm-hmm.
that concept of mortality. Like, are we
Mm-hmm.
denying pregnant and postpartum parents that
Mm-hmm.
opportunity that people often will get during doing their own grief work,
Mm-hmm.
closer to
Yeah.
the end of their lives?
Yeah, I think so. There's not many spaces that I've seen that talk about that part of things and the anxiety that can surface during that time. And there's also that aspect of attachment that comes up, and fear, I think, in attachment. And because whenever we find ourselves attaching, there's also probably close or near a fear of loss.
Yeah.
And I think that there is this pattern or history of focusing on attaching and not recognizing that it also means that there might be some anxiety or fear around losing
Right. Right.
something or someone too. And then I think some anxiety culminates from that.
Definitely. Yeah.
Hmm.
Yeah, and it's because when you're pregnant and then you're bonding with your baby after they're born, it is this really intense experience of literally attaching to a new human being, but also realizing that there's very little that you can control, you
So
know,
little, yeah. Hmm.
and you have to let go of attachment to an outcome for your child. And that is so much harder than letting go of, I think, attachments to outcome for yourself. I think it's hard when you're doing that for yourself, but it's
Yes.
harder when you're thinking about your child suffering and your child,
Yes.
going through something.
Hmm.
It's such a more difficult process to kind of let go of
That's
attachment.
been my experience too. And again, there is a myriad of different experiences that people will have with that too. Um, but I absolutely think that it is definitely harder for me as well, and continues to be. As you watch your child go through different stages and have different challenges. And, there's a lot to be concerned about or fearful of. And so that there's definitely, room where that anxiety can grow. And, where are the spaces to normalize that?
Right.
And even more, where are the spaces where we can embrace that opening, you know?
Right.